Hello, class. This is Dr. Amira, and this is PAMs. We made it to slide 30, talking about cryotherapy. I think, yeah, slide 30. Yeah. All right, so cryotherapy is the use of ice or cold therapy, and it does have an effect on. It has hemodynamics changes, basically affect the blood supply, the constriction of the blood vessels, will affect the blood supply to the area. It does have neuromuscular effects and metabolic effects. It does reduce the metabolism in an affected area and also produces neuromuscular effects of nerve sedation and numbing of the nerves in the affected area. It is indicated in inflammatory as an inflammatory control. So initial inflammation after an injury, we use ice, so it reduces the inflammation again by reducing by the affect the blood supply to the area and reducing the metabolic rates, etc. It also is reduced for edema control. So we use ice and cold to reduce edema. It is used for reducing pain and modification of spasticity. It does actually reduce spasticity if used properly on the belly of the muscle. And a lot of therapists will use like a styrofoam cup ice that is frozen and they will rub it on the muscles to reduce the spasticity. It can be also used to facilitate under uh, uh, to facilitate muscles that are flaccid. It has to be rubbed differently, obviously. It is contraindicated in hypersensitivity to cold or cold intolerance. So anytime you have a client who is hypersensitive to cold, we don't use ice or cold therapy. It is contraindicated in uh, those two conditions, cryoglobulinemia, I think I said that right, and Raynaud's disease. The first one is an abnormal protein that is present in the blood, and it becomes with the use of ice, it becomes thickening. So thickening of that protein in the blood almost becomes like gel or jello. So it's contraindicated if the clients have that. I have never seen that in any of my patients. Raynaud's disease is obviously hypersensitivity to the cold in the extremities and severe constriction of the blood vessels in the hand and the feet, reducing the blood flow to the extremities. So we do not use that. We also don't use cold therapies over regenerating nerves. So the peripheral nerves that are regenerating, we try to avoid ice directly over that area of regeneration. Uh, Peripheral vascular diseases of poor circulations, etc. Try not to use cryotherapy on those areas. Otherwise, you're reducing blood flow to an area that already had reduction in blood flow. So it's obviously contraindicated. Precautions: you have to be careful when you are applying a cold over superficial main nerve branch. So some of the branches in the upper extremity are superficial, so you just have to be careful directly over them. Open wounds, obviously, clients with hypertension, because again, you are affecting blood flow to areas over other areas. So people with hypertension, blood pressure, that might complicate their blood pressure more. Areas with poor sensation and people who are very young or very old, you just have to be extra careful. There are multiple variations of ice packs. The top right over here, this is really nice because you could use it for cold and for heat. So you could microwave it, you could freeze it. So it's really work as both. Obviously, this is your classic bladder that you use for ice and cold. You put it in. If you use that in the clinic or home health or something, you might want to put a little bit of salt with the ice so it doesn't freeze up and becomes one big chunk of ice. In a bind, you could use mixed vegetables. It's really good. Put them on a plastic bag or a towel or something, and use them as an ice pack. You could make your own homemade ice packs. In this case, 1 part rubbing alcohol, 3 parts water, and you can make your own. And if you want to be really extra fancy, you could use one of those circulating ice cold water pumps that circulate the cold water back and forth using a water pump in here. Those are usually insulated containers, and they have a pump in here, and you plug them in. They're very common after orthopedic surgeries, shoulders and knees, etc. The trick to them is to get the water and ice ratio correct. Otherwise, it will not pump correctly. Instructions for ice and application of ice. Always instruct the patient, tell him what to expect. You check for temperature, check the skin integrity, position and drape the client appropriately. Make sure you have access to the area you want to ice. Cover the area with a single layer of moist towel. Moist towel would improve the transfer of heat or cold. I usually use dry, but some people use moist towels. And this is usually discarded, or you send it to the laundry afterwards. Place the ice pack over the towel, and then make sure it's molding correctly to the part, to the shoulder, to the hand, etc. And you cover the ice pack with another layer of dry towel to maintain insulation. Treatment length is about 10 to 20 minutes on average. By then, 20 minutes afterwards, the ice will start basically either melting or losing its temperature. Treatment up to several hours are accepted, such as on that the machine showed you earlier. This machine here, we hook up usually patients up to 3-4 hours in between therapy after a knee replacement or a shoulder replacement. So it is acceptable to hook it up to 2, 3, 4 hours because it will maintain the temperature of the cold water. After that, remove the ice pack, dry the client, check for the skin, general physiological responses, usually look at the area, and you follow up with your regular exercises as indicated, whatever the exercise you're trying to do, manipulation, or if you've reduced the muscle tone or the spasticity, you can follow up with your regular exercises. Um, if you are icing before mobilization of a shoulder or a knee, then you can follow with whatever it is you're doing, active exercise, passive or active assisted exercises, etc. Contrast baths are basically you're getting the best of both worlds. You're getting the best of the hot and the cold, and they usually the normal temperature for those is the client will dip their hand or feet in 110 degrees Fahrenheit water and dip it in a 65 degrees warm water and then a cold water at 65. Try to be as close to those temperatures as possible, knowing that the dipping back and forth will affect the temperature of both fluids. The purpose and effect of a contrast bath is primarily used as a vascular exercise. It causes an alternate constriction and dilation of the local blood vessels. So again, the blood vessels will constrict and will dilate, constrict and dilate. And this is a vascular exercise. Stimulates the peripheral blood flow, and it will help stimulate healing. Both the heat and the cold produce effects that may be undesirable. So by using contrast baths, those things will basically equal out. It is indicated in impaired venous circulation. So whenever there is a venous circulation issues, doing this vascular exercise is good. It is good for subacute or chronic inflammatory conditions and injuries. It is really great for edema. I've used it a lot for edema management. It works beautifully. It works on sinus and congestive headaches. And if you apply it to the feet, or I've never used this, but this is what the books says. If you use it to the hands and the feet, it draws the peripheral circulation and uh, blood flow. It kind of draws the blood away from the sinuses that you might have sinus issues. I've never used it for that purpose, but that's what some people would say. It is really good for reflex sympathetic dystrophy too. It is contraindicated in malignancies, um, active bleeding, cold hypersensitivity, peripheral arterial diseases, cardiac and respiratory insufficiencies or instabilities, uh, contraindicated in fevers and people who are young or old, and X-ray tissues too. Precautions. uh, Anybody with skin that has sensation issues, and sometimes patients who have no apparent contraindications will develop chest pain because of this vascular exercise. So try to carefully monitor those clients. Instructions, what we do normally is instruct the patient and tell them what to expect, check for the temperature for uh, both vials of water, and like we said, 110 and 65. Position the client comfy, drape necessary to keep the rest of the patient warm and dry. Um, Prepare the 2 pairs of water uh, to the depth will cover the area to be treated. If you're doing the hand or the foot, the warm water needs to be about 110 degrees. The cold water needs to be about 55 degrees Fahrenheit. The temperature should be selected based on the condition of the client. You could go 110 to 100 to 110, 55 to 65. Immerse the part in the warm water for 3 to 5 minutes. So this is usually not a problem. The clients will put their hand in there. Warm water is fine. Take it out, immerse it in the cold water long enough to produce vasoconstriction, usually about 1 minute. A lot of times people can't even handle the 1 minute. So we'll see how we do in the class. So 5 minutes in the hot, 1 minute in the cold. You go back and forth up until you do about 6 or 7 times back and forth. 20 minutes, average 20 minutes time. Treatment may end if either the hot or the cold, so you finish the treatment, you end the treatment, depending on whatever the results you want. For edema, for example, ending in cold may be more beneficial. So for edema, we usually end with a constricted blood vessels because you go back and forth until and but the last one needs to be in the cold water for the blood vessels to be and the lymph nodes and the lymph vessels to be constricted, so you end in cold. If you want to do massage, for example, or lymphedema drainage or something, then you may be better off ending in the warm water, in the warm, and then you have blood vessels and lymph nodes that are open, lymph drainage that are open, and then you can do your retrograde massage. Once you do that, you dry the client and allow them to rest, and then you follow up with any exercises, drainage, massage, elevation, or whatever is indicated for that client. We will talk about ultrasound later.